this is a question that's related to counseling, there's a lot of talk, or has been a lot of talk for quite a while now, I think, about cultural competence and even cultural sensitivity and so on. And there's been a lot of different ways of trying to position that. And a lot of the times it seems to me, and I think you've mentioned this too, that the assumption is that the therapist is kind of the unmarked category, and the client is the one who you have to become culturally competent towards. But you have written that, the ethnic identity of the intersectional identity of the therapist clearly has an influence on therapy too. And how do we understand better how to work with that in therapy? And I wonder if you could talk about your thoughts on that at the moment.
Yeah, there's
your experiences.
As much as we need lots more work in multicultural counseling, most of the stuff in multicultural counseling is really about white therapists working with clients of color. Like that's the main focus of it, and we need lots of that. So it's not that we don't need that, but there's not very much guidance for therapists of color on working with any kinds of clients. And so I think that's something that we really need, especially as we're trying to have more of a pipeline into our field of therapists of color. And the other thing is, when therapists there's things that are written about when there are ambiguities, about therapists, or when stuff's been written about therapists who are pregnant, and it's sort of like, your clients are going to see this over the months, and so when there's personal stuff that they're curious about, or that you need to share with them in various ways, and so there are questions that therapists get, that I've gotten, about my ethnic background, about whether or not I'm married, about whether or not I have children. There are all these things, and I remember in graduate school struggling with how do I answer this? And Chuck Claiborne was my supervisor at the time, and he was very good in working with me in terms of not just giving me an answer, of helping me to explore that and unpack it, and what would be challenging about answering this question, and so that was really helpful, because I think identifying the things that feel like vulnerabilities. It's like, I'm sharing a vulnerability with a client. If they say, what's your ethnic background? And I have to, sort of, now we're talking about these things that put me in a different kind of position with them. That are asking about sexual orientation. What do I share? What do I not share? Knowing how biased people are against bisexuality. What do I share? Even with lesbian and gay clients, there's biases. So I don't have the answers. I don't know exactly, but I think we need a lot more work in that area, because it puts us in a vulnerable position that if we haven't thought it through, and if we haven't had the supervision and guidance in it, it makes us less effective therapists. And I think we always need to think about how we're there for our clients, and that means we've got to be able to work with all of those things. I think that people are probably doing that better now in training. I don't practice now. I haven't seen a client since internship. But those early experiences, especially at points where I was sort of developing my relationship with some of my identities, was really important.
Yeah.